There for Care is brought to you by CareScout with the goal of sharing real-life conversations about aging care. Views expressed on this program are the speaker's own. We do not provide medical, legal, tax, financial, or other professional advice. Always talk to your own professional advisors for advice tailored to your needs.
We're going to walk you through your personal predictions for your long-term care needs. Almost none of this is going to be covered by your health insurance. It's so extremely expensive, but it's also so operationally complex. It's a massive, massive problem. People don't talk about it because it's taboo. I've seen a lot of people have an easier time talking about death than they do talking about needing someone to help them get out of bed.
How do you think about the role of emerging tech like AI in improving that experience and those outcomes?
Right now, we're in the early stages of sort of an AI revolution. I think especially in aging, AI has a particularly outsized potential for impact. I think that's absolutely huge. For someone like me, it's more convenient. But for someone maybe 50 or 60 years older than me, it's enabling. Talking about aging, and that's kind of old, and AI, tech, oh, that's new, those don't go together. I think that they actually marry together better than almost anywhere else.
Hi, welcome to the There for Care podcast by CareScout, a podcast about all things aging care, whether you're navigating it for yourself or for your loved one. I'm Amy Rein, and today we've got Evan Ehrenberg joining us for the show. Evan is MIT's youngest neuroscience PhD student, a Forbes 30 under 30 recipient, as well as a visionary entrepreneur and angel investor. He's the current COO and co-founder of Waterlily and the former CEO and co-founder of Clara Health. Today's episode, we're going to get into the investment community and how we're investing in improving the aging journey, as well as AI's role in caregiving and the aging experience. So thank you for joining us, Evan.
Thanks so much for having me, Amy. It's a pleasure to be here.
Thanks. So just to start out, you bring this really unique lens to the aging care space with your highly technical expertise and your early experiences in investing and founding companies. Can you tell us a little bit about your first healthcare startup experience and maybe how that informed your next act with Waterlily?
Yeah, it was really interesting. I got into entrepreneurship and startups completely by accident, as I think many really great founders do. In my PhD at MIT, I was recruiting participants for a brain imaging study. And the way we did it is a grad student with no background in marketing, like you have, would design a flyer and go post it on bulletin boards around campus. And hopefully, if you waited long enough and you were good enough in design and it was attractive enough, you'd maybe get 20, 30, 40 people to come and you could do a brain imaging study with them. And it was incredibly inefficient. Nobody was very good at it. A lot of studies, if you're looking for healthy participants, it was one thing. If you were looking for more neurodiverse individuals, it would take years for people to get the data. And the funny thing was, there were lots of people who wanted to participate, and they thought these studies were so cool, and they get a picture of their brain afterwards, and they get to contribute to research. And so it felt like, there should be some connection point here. And so started thinking about that more and thinking about, there should be like some sort of marketplace that brings these people together, sort of like, have Uber, Airbnb, have one for research studies. And as we started looking into that, we saw, yes, there was a use case there for academic research like I was doing, but there was a much, much larger need for this in the clinical trials industry, where you're testing new drugs and you need to be recruiting hundreds to eventually thousands of patients. And some of those would be healthy participants, but a lot of them would be people with medical conditions, oftentimes rare medical conditions, and then a bunch of other criteria on top of it. And so it was astonishing to learn that bringing drugs to market, one of the biggest delays was not just getting through the clinical trial, it was finding the people for the clinical trial. And at the exact same time, you had thousands of people who wanted access to the latest drugs. Even if they're in testing, they can get it for free. They can start to see something that might have better effects than what they're seeing from what their doctor's able to give them. And there was just no real, there was a clinicaltrials.gov as a government website, and it just wasn't enough. And so that's how we started building for that when I was part-time PhD, and it started taking off. We were able to get some great investments from like Founders Fund and Coastal Ventures from Silicon Valley. And pretty soon, instead of it being a part-time thing I was doing on the side of my PhD, I dropped out in my 6th year of my PhD right before defending my thesis to just focus on it full-time because we actually had we received a card in the mail from the husband of a patient who we had helped, where she had late stage breast cancer, I believe. We got her into a clinical trial. And then she passed away, which was our biggest nightmare. We always at some point, something's going to happen. And he sent us a handwritten letter and just said, thank you so much for helping us find the study. We know that we left no stone unturned, and I can sleep at night knowing that I didn't just look harder to find another option for her. We looked, we found it, and we gave it our best. And just seeing the impact it could make, spending another year to finish my PhD versus potentially help hundreds or thousands more patients, there's just no comparison. I was doing the PhD so I could help people. And so then I was full time into that and, scaled that company over time and then exited and started investing in other founders who I thought were making a big impact. And that was eventually how I found Lily when she was starting Waterlily, and invested and eventually just became really hooked with what she was building and ended up joining her in the company.
Yeah. Can you talk a little bit about that hook? What was it? What is it about the long-term care space that was so intriguing to you as an investor? Yeah.
So I'll be honest. My investment thesis is really simple. It's pretty much just invest in my friends and my friends' closest friends. I just had noticed that as I built my company and my friends built theirs around me, almost all of them were really successful. A couple didn't make it here or there, and some of them had kind of but almost everyone was incredibly successful. And the ones who didn't make it the first time, the second time they completely crushed it, and the third time too. And so I just have this rule of if I know you and we're good friends, you're doing something, please just let me put a small angel check in. And it works really well. And I've heard the same from lots of other angel investors. And so with Lily, she was a friend of a really close friend of mine. I heard she was talking about, starting a company. I got to know her. And she also went to college super young, also went to Berkeley undergrad. And she was at NASA by 16. And she had this real tight personal story to long-term care. And she was a data scientist and geneticist and how a really smart person. And she was going to solve it. And I was just like, I don't care what you're doing. That sounds great. Especially also you see a lot of really early stage founders, they pivot, because you have one idea and you try it and it doesn't work and you pivot. And so I really didn't care what she was doing. I just wanted to invest in her. And so I wrote, tiny little angel check into the first round. And I would hear updates from her. And essentially it was just how well it was going. It was working really, really great. And all the feedback is wonderful. And everyone's signing up for the wait list. And I was like, oh, you're supposed to be harder than this. You're supposed to have to pivot a bit. And I thought I was going to give you more advice and stuff. And so I kind of dug a bit deeper. I said, okay, so what is long, I know you're in healthcare, what is long-term care? I don't really have much experience with it. And she just said, here, try it for yourself. And so she gave me an early alpha version of the thing she was building. And it asked me to answer a bunch of questions about my demographic information, my medical information. And then it said, we're going to walk you through your personal predictions for your long-term care needs. And it showed me my likelihood, which was pretty low because I'm pretty young. And it showed me the cost, which was extremely high because healthcare inflation compounds for me over many, many decades. And it said, and almost none of this is going to be covered by your health insurance. You're going to have to cover this out of pocket or look at other solutions. And I was looking at, I think $6 or $7 million for me. I live in a high cost living, area and everything, but I was just shocked. And also I had just built a healthcare company. How did I not know about this? How did I know it wasn't covered by health insurance? And it specifically echoed back to at Clara Health when we were helping people find clinical trials. Very often it was because there was no other treatment option for them. And so a clinical trial was really the best thing you could possibly get. But we unfortunately also saw a lot of cases, typically with autoimmune diseases, where there was a drug on the market that worked for them, typically Humira or some other biologic. Humira is the most expensive, one of the largest grossing drugs. And maybe their insurance was covering it. They switched to a new insurer and they didn't want to cover it because it's so expensive. And they didn't want to go on corticosteroids because those have more side effects typically, and they just didn't want to risk it. And they saw there were other clinical trials testing for sort of generic versions called biosimilars of a Humira or other type of drug. And it would be covered by the pharma company for the duration of the clinical trial. So we had a lot of people who could have been treated if their insurance would cover it. And they would come to us and it felt so convoluted. Oh, you're going to a clinical trial to do it just so you get it for free, because they were bankrupting themselves, paying out of pocket for this extremely expensive. I have friends who have autoimmune diseases who are on it. They max out their benefits in the first 2 weeks in January, or max out, not their benefit, they max out their deductible in the first 2 weeks in January. And it was it was devastating to see. And thankfully, it's a pretty small portion of the population, but autoimmune diseases are pretty common. Long-term care, on the other hand, I also didn't know how common it was. I mean, once you're looking at our aging population, it's the majority of people are going to need this. And then as expensive as drugs like Humira are, gosh, it sure looks cheap compared to long-term care costs. And then with the things I saw in clinical trials with autoimmune diseases, sometimes it's not covered by health insurance. Well, essentially the rule is long-term care isn't covered by health insurance. That's the go-to. And so it was like, oh, that problem that I thought was so bad in Clara Health, you've just found this incredibly huge problem that it feels niche because it's not talked about, but this feels like one of the biggest things we could possibly see. Anyway, so I learned more and more about it. And I got really just obsessed with it just as a problem. I was so excited. I invested in Lily. I'm like, oh, this is so great. I started giving her more and more advice, and a lot of it unwanted because she knew what she was doing. But eventually I got to help here and there and make some improvements. And I was just spending so much time on it. We just sort of talked and said, look, you should probably join as a co-founder. And it's been, I think that was maybe 2-ish years ago. She's been doing the company for maybe 3 years. So it's been a real pleasure to be able to work with her on it. But that's sort of how I found my way here and saw some parallels from what I've seen before.
Yeah. So, aging and, these conversations, you're saying these things, they're not things people like to talk about. They're generally unpleasant. It's the deeply personal experience. So how do you think about the role of emerging tech like AI in improving that experience and those outcomes?
I think especially in aging, AI has a particularly outsized potential for impact, where right now we're in the early stages of sort of an AI revolution. I want to say it's so funny. My PhD was in studying the human brain in order to learn how it works so we could make computers more intelligent. And we've always been saying, AGI, so like human level intelligence, is 20 years away, and it's always 20 years away. And even in my PhD, that's what it felt like. It felt like we're striving towards it. We'll get there, but maybe I'll live to see the day. Mm-hmm. And then now to see the explosion we're happening, it is so different from what we've been seeing for the past decades. It really is quite special. And we're just in such the beginning stages, and it's changing so rapidly. But I think right now, a lot of people think about generative AI and large language models, sort of the ones that are relevant to the most recent explosion, as, oh, if you're in business, you can use this to be more effective, or, oh, it might replace jobs, or, oh, you have to be pretty smart to use it. What I actually see it is it's a great equalizer, because a lot of the tech platforms that I might find really easy to use, Airbnb or DoorDash or just my email, for an older population that didn't have the benefit of growing up with technology, can sometimes find it to be unintuitive. Because generative AI specifically large language models, typically can have a natural language interface, and even one that's over voice, not just typing. I've seen it make so much more today information accessible to like my grandmother, but then instead of having to figure out how to use Uber, you can just say, hey, please call me an Uber. And then we're now starting to see the development of, agentic AI that can go into these apps and do things for you. And for someone like me, it's more convenient. But for someone maybe 50 or 60 years older than me, it's enabling. They can finally use this. And so I think that's absolutely huge. The other areas I think that we're likely to see is in care delivery. It's so extremely expensive, but it's also so operationally complex. I think as we look at AI automation, we'll be able to hopefully make people's jobs a lot easier, a lot faster, and hopefully bring some of the costs of care delivery down. And then you even start to look into like robotics and how fast that is developing. We're even earlier on the impact there, but it looks like there's a lot of potential there. And getting robots into the home to be able to maybe not fully take care of someone, but at least start to help, again, can make a huge, huge difference here. So I think as it almost feels weird of like, oh, talking about aging and that's kind of old, and AI, tech, oh, that's new. Those don't go together. I think that they actually marry together better than almost anywhere else.
Yeah. And I want to stay on that access theme for a second. So there is this sort of democratization and equitable access theme, with your experience with Clara Health, and then getting into Waterlily as well. So why do you think planning for long-term care needs has been more of like a niche or luxury to have up to this point? How can we change it? Yeah.
It's a great question. I think it's a combination of the topic itself is usually not very fun. It's morbid, it's scary, it's expensive, and it's not just death. It's growing older and not being able to fully care for yourself and needing help from others. And I've seen a lot of people have an easier time talking about death than they do about talking about needing someone to help them get out of bed. And so it's not talked about a lot. And I also think, surprisingly, I don't know, people seem to be more open to talk about journeys through cancer, but less of a conversation topic talking about caring for their grandfather or their mother or their in-law. And so it's almost just been a little bit of a taboo topic. And so I think it gets skirted around. People don't talk about it. There's an opportunity, I think, for, doctors can talk about it. They oftentimes still don't, or they might refer to just like a pamphlet, maybe a gerontologist if you're lucky. And then, we work in kind of long-term care planning at Waterlily and a lot of time in financial planning. And we've seen some wealth advisors do a phenomenal job bringing this topic up, but we've talked to so many, and they just say, again, it's a morbid topic. I don't want to be a downer for my client, even though, yes, it would prepare them. I just don't feel comfortable with it. I don't feel it's comfortable asking about their medical information. And a big one is it is quite complex. And it's a lot for a care coordinator whose job it is to know all that stuff, for someone like a wealth advisor to come in and, start bringing this up with their client asks some great questions, I'm sure. If they don't know the answer, they could look ill prepared and maybe not look so good. Maybe they lose the client. And so it just seems safer not to bring it up. And so that I think is a big part of why. Another piece is, historically, we've seen that usually the adult children are the ones taking care of the grandparents and the parents, and oftentimes in-laws. And typically it is the wife in the relationship who's taking care of her parents as well as her husband's parents, in a heterosexual relationship. And we're starting to see less availability of that as we see both spouses in the workplace having their own careers, very often moving away from, very far away from home, into major metropolitan areas, typically on the coasts. And for them to come back home gives up, obviously, a lot of income that they're leaving, and also a big career gap that might be really hard to ever catch up to that again, as well as they may have children of their own. They may have chronic health conditions. There's so many things that are limiting kind of what we've seen historically, moving us towards something where it's sort of more expected you're going to have at least some professional support, if not entirely professional support, but the costs are only increasing staggeringly. And so it does feel like this almost sort of hidden, it's a massive, massive problem. People don't talk about it because it's taboo, and it's starting to blow up in not just individual families' faces, which is horrible and has been happening more and more and more, but now as a society and government starting to see this, it's really sort of coming to a tipping point.
Yeah. And I think, just to get in to the investing angle a little bit, to your point, it does seem like it's starting to sort of explode in the zeitgeist now, as far as that caregiving experience and the shortcomings of the long-term care infrastructure in our country and things like that. So the capital's maybe a little late, but it's here, right? And I think there's been a lot more investing in the space in recent years. So when you think about, from your angel investor angle, what's happening and where people are investing in the aging care space, what are you seeing? What would you love to see more of or less of? What are some of the highest and best uses you've seen?
It's a good question. I think we have historically seen less venture capital here. Part of that is because just venture capital itself is pretty young. So, number of decades old. And then healthcare venture is also pretty young. And then you get into niches. And so long-term care is a little more recently discovered. But I also think, for all the reasons you just described of why it's sort of taboo and not a popular topic, it's less sexy for especially like tech founders. They want to go work on drones and they want to work on general AI for, whatever it's going to be. And places like long-term care and aging care generally there's just typically less talent flooding into it, especially from the typical centers of San Francisco Bay Area, things like that, New York. So I think there's been historically less, but I think what we're starting to see is, again, as we reach this tipping point with the aging population and the cost of care, more founders are starting to look this way. And as more founders start to do things, if venture capital follows, the areas though where I'm most, to answer your question more directly, where I'm most excited, obviously I'm excited about the work that Waterlily is doing and trying to use AI to just make this very taboo, uncomfortable topic much more approachable, much more personalized to you by using AI to predict your future care needs and help build an optimized plan for you. But I also think I mentioned really just the robotics is going to make a huge difference. It's going to be probably one of the longest horizons, but it's going to be one of the biggest impacts. The impact to efficiency in care delivery, just like on the back end, stuff that the patient never ends up seeing, the family never ends up seeing, but just how things get scheduled, how blood work gets done. Also, I think in-home patient monitoring. Actually, one of the things that was really cool is Lily, before starting Waterlily, when she was just really passionate about this space because of her personal family experience with this, she had built a patent for a computer vision algorithm using LiDAR and other technologies for like anonymized fall detection and like fall risk assessment. And so patents like what Lily made, as well as other companies are doing this. And that's not part of Waterlily. It's just part of her passion. It's her personal patent. I think will allow us to intervene a lot earlier. And so you catch someone who maybe is going to fall before it happens, or if they fell once, you can actually start to intervene and make sure they don't fall again and have worsening there. So those are just some of the areas I'm noticing that I'm really excited to see more of. And these will take years to, in some cases, decades, but it'll be really exciting for the industry.
Yeah. So just to bring this home for our listeners, you've spent the bulk of your life in technology and working on those foundational elements of AI. And now with Waterlily, in how those models can help inform those conversations. So when you think about AI in the long-term care space, what do you want people to know about how this technology can impact positively the future of long-term care?
One of the things that we see in what determines what a long-term care event looks like is that individual's engagement in their life. And a lot of that is like loneliness and socialization, but also just how they interact with the world. And I think that AI has the opportunity, one, to help people more easily connect with their loved ones and others by helping them figure out how to use things like, FaceTime or Zoom, helping them be able to order grocery deliveries to like Instacart or something when they may have struggled to do that before. They would have had to have the kids help call and do it, and you can maybe schedule more things. I think just general applications of like agentic AI can make a big impact there. I also think that we'll start to see more agentic AI companions and that might feel very dystopian, but we're already seeing it with sort of younger populations, and there might be cause for concern of how that might shift their social growth. But I think especially with an older adult who they've developed all their social skills, they're great. They don't have any issues there. Being able to not be alone, for the gaps where you're not talking to friends or family. This is when you're in a home environment. If you're in a community living environment, you may have more opportunities. But to always have someone to talk to that has memory of your past conversations, and that can also be helpful and proactive, because these conversational companions also are trained on all like medical literature, and they know about long-term care. And so as you share things about your day, they may flag stuff. You could potentially even connect that back to the adult children and say, hey, your mom shared this today. I find that a little concerning. Maybe she shouldn't be doing that. Or, we might be seeing what appear to be some early signs of dementia. And so it's something that can both be, I think, really enriching for the individual going through a long-term care event and ultimately improve the duration of their quality of life, and also help flag things that you can intervene to, again, continue to make sure it's a great quality of life for as long as possible.
Yeah. And so on that note, for our caregivers, any sort of tips, tricks, hacks on how our caregivers might be able to use those publicly available engines like ChatGPT, Google Gemini, Copilot to make the caregiving experience a little more seamless?
Yeah. First one is just start using it. And I would say try to use it less like a tool and more like a person. And the reason I say this is when you tell a person to do something or to look something up for you, you typically give them a lot of context. I tend to be very verbose, as you can see in this interview. But I'm giving you a lot more context than like a Google search. And I see a lot of people talk to, a ChatGPT or a Gemini or something, and they almost treat it like a Google search, and it will work. It will give you some pretty cool stuff. But if you tell it more, like really get into like, I'm trying to figure this thing out. I've already tried this and I'm wondering about these things. And I want to just know, like, what have you seen out there? Just give it a few sentences. You will get such a more interesting and relevant. I mean, I just use it for so many things in my daily life. I think probably as a caregiver, you can find a ton of resources for caregiving. You probably find a bunch of fun activities and stuff. And I would encourage, the person you're caring for, because it's either a text interface or a voice dialogue, there's a pretty good chance that they can start to learn it. And I think it'll really empower them. And then, of course, as we're just now starting to see these agents plug into things where you can, order groceries or call an Uber, do things like that. And so that I think will be really empowering. Obviously, I mentioned for the aging individual, but also for, the caregivers who are helping provide that care. And so I would just say start using it as much as you can. And a big reason I say to do that is, even if today it can't quite do what you want, it's growing so fast. It literally might be a month away, a few weeks away, that the thing you tried to do, back in January, it just does it no problem now. And so what a better way if you're using it constantly, you'll know exactly when that is and start empowering yourself just with the free tools. And I'll also share, obviously we're seeing advancements constantly. In my experience, paying $20 a month for like a ChatGPT Pro subscription or something, you do get I think a better model. You can unlock more things. So if you're not quite, I think what is it, Sam always says like, feel the AI or something. Mm-hmm. If you're not quite feeling that, try the subscription, see if you feel it then. If you don't, cancel it, whatever. But that's what I'd recommend trying.
Awesome. Thank you so much for the conversation today. Thanks for spending your time with us. And that brings us to the end of today's episode. I'm Amy Rein. This is the There for Care podcast. Be sure to like and subscribe and share with all of your friends that are going through the aging journey.